And the deadline to buy health insurance in California is approaching.
After the break, Lauren will chat with Craig Gussin of Auerbach and Gussin Insurance. He'll join us once again to talk about the top 10 things you need to know about insurance for 2021. Craig's standing at the ready right there, or sitting at the ready. He joins us in just a bit.
The last day to buy health insurance here in California is quickly approaching. Joining us now to discuss the top 10 things you need to know about your health insurance for 2021 is Craig Gussin from Auerbach and Gussin Insurance and Financial Services. Good morning, Craig. Good to see you.
Good morning, Lauren. How you guys doing?
Doing well. So this, we have a deadline approaching. We have new changes for 2021. So really, we're breaking it down pretty simply here. So what do we need to know first and foremost?
The question I've been getting a lot asked to me is, you know, with the new administration, how's that going to affect California's health insurance? And we're a state exchange, so really it's not going to affect us that much at all. From what I'm hearing and reading, because of COVID, everything the administration tries to do is going to be very slowly done. I mean, they've spent so much money in Washington, D.C. and in Sacramento with COVID that there really isn't money left over right now to do anything. So you're going to see everything go very, very slowly. Again, we're California. We're still going to have a penalty if you don't have health insurance for 3 months or more. Your penalty is $695 per person in the family, half of that for a child, or 2.5% of your income, whichever is higher. So it's really important to have health insurance. You still have time to do it. Today is the 21st. You have 10 days. There's health insurance agents, you know, across the state that are there, you know, helping people every day. We're one of the essential businesses that have been open since day one of the COVID. And, you know, we can help you there. Other things that are going on in the top 10 list is people ask you, well, what happened after February 1st? How do I get health insurance? Well, you got to have a qualifying event, which means you got laid off from work and you lost your health insurance. You got divorced. A qualifying event would be if you have a baby, you can add the baby to your plan. But you can't call me up in June and say, you know, I haven't had insurance in a year and I think I want it now. We can't get it for you. It's against the law. So you're going to have to wait until next January. Really important to know. And one of the things we're telling all our clients, Lauren, probably more than anything, check with your doctor in the next 10 days and make sure that the plan you're on is still being taken by their office, especially if you have a PPO plan. You know, HealthNet and Blue Shield have PPO plans and that are offered here. If you have a Kaiser plan or a Sharp plan or a Scripps HMO type plan, you should be fine. But we really worry about the people who have a PPO plan so that there's no surprises come maybe March or April where the doctor is no longer in network because they decided to make a change. And we've seen that happen before. So just food for thought. If there's something going on with your health and you want to make a change, you still have time to do it. Even though you may have made a change in January, you know, as of January 1, we can still change it February 1. So be aware of it. Those are the kind of things that we're looking at right now.
And quickly, before we run out of time, Craig, there's since we focused a lot on mental health issues on the rise with this pandemic ongoing, I understand there are changes with mental health laws. So what is now being covered?
So what's now being covered was one of the last things the Trump administration did was that now if you have one of the major mental health issues, it's going to be covered just like any other kind of medical condition. So it's not like, oh, we don't cover that anymore. So it's getting a lot better. There's a whole list you can Google and check. They also did a surprise billing, too. So there's no more surprises when you go to a hospital and find out the hospital takes your plan, but the anesthesiologist, ER doctor, radiologist don't. They can't do that anymore. So we're really, and also air ambulances. So they're really trying to protect the consumer. The one thing they haven't done yet with surprise billing is the ambulances. You guys see every time you do a story about an accident, the ambulance shows up. But the ambulance can charge $5,000, $10,000 and the insurance company is not paying that much. And that's another surprise bill that the California Association of Health Underwriters has been working with in Sacramento. Reach out to your legislators, talk to them about it. It's an unfair situation that we as agents deal with.
Well, certainly some good news there then, and people have 10 days, so definitely make the action to figure it out. But Craig, as always, appreciate you giving us the heads up on some important changes, and hopefully we can get it all figured out for 2021.
Good to talk to you.
You
Good
too.
to hear you and Paul's voice, and Happy New Year.
Happy New Year. Take care.
Take care. Bye-bye.